Are you enduring daily pain, thinking it's inevitable with age? Is joint pain that medicine and injections can't solve making your life difficult? Have you tried injections and medication, but your back and knees still throb and cause you pain? Are you giving up on treatment, thinking it's just something that comes with age? Whenever I hear these complaints in my consultation room, I always say this: just gently massage these three spots for 3 minutes every night. You will personally feel your back, knee, and joint pain noticeably decrease within just 3 days, as if by magic. Today, I'm revealing a secret that has shown amazing results in my practice. If you don't know this method, you might continue to suffer from morning pain and rely on medication every day. But don't worry, with this simple method, you can break free from pain and regain a vibrant later life. If you watch this video until the end, I can confidently say that your thoughts on pain will be completely turned upside down. It's all about massaging these three spots for just 3 minutes every night. Why am I so sure about these particular areas? Because it's an effect I've directly confirmed while treating countless patients. This isn't just the usual advice like exercise more or get treatment. Patients in their 60s, 70s, and 80s have already experienced miraculous changes. Nancy, a 78-year-old living in New York, had suffered from knee pain for over 15 years. She couldn't even take a short walk around the park near her house. When Nancy first came to my clinic, her knee osteoarthritis was quite advanced. She underwent medication and physical therapy, but didn't see much improvement. Then I taught her the 3 secret point massage techniques I'll share with you today, and Nancy diligently practiced them every night. Surprisingly, within 2 months, Nancy was able to walk for 30 minutes without a cane. The 3 points I'm going to show you today are particularly effective for back, knee, and joint pain, which are common in old age. Our bodies have secret points that relieve pain. These points help resolve pain by promoting blood circulation and reducing inflammation. From now on, I'll reveal the core secrets to resolving back, knee, and joint pain. Before we begin, if you think this will be helpful, please support me with a subscription and a like. The first secret point is the front of your thigh. You see, if your back hurts and you only rub your back, or if your knee hurts and you only massage your knee, it's actually difficult to see significant results because our bodies are all connected. Let me tell you the story of Charlie, a 70-year-old living in Washington. Charlie had been suffering from symptoms of frozen shoulder for a long time. Because he sat in front of a computer for long hours at work, his shoulder hurt severely every time he lifted his arm or washed his hair, and the throbbing pain at night often disturbed his sleep. Moreover, because he hunched over due to the shoulder pain, his back and knees also started to hurt. Charlie went to several hospitals and received medication, but the effect was only temporary. Then, through an acquaintance, he found out about me and happened to visit my clinic. After examining all of Charlie's shoulder, back, and knee pain, I said this: massaging only your shoulder when it hurts won't help much. The body is all connected. Rather, massaging this area on the front of your thigh can correct your posture, which can improve your shoulder, back, and knee pain together. At first, Charlie was skeptical about how massaging his thigh could be related to his shoulder, back, and knee pain. But since it was an easy method, he decided to try it once. Every morning and evening, he pressed and rubbed the front of his thigh with his fingers for about 3 minutes. At first, there was no change, but after about a week, he definitely felt less pain when lifting his arm. And about a month later, a truly miraculous and surprising change occurred. In the past, his shoulder would pop and hurt a lot just from lifting his arm, but now it felt noticeably more comfortable. What surprised him even more was that his back and knee pain had also improved. You see, if the muscles in this area on the front of your thigh become tight, it can cause your back and pelvis to tilt forward and your knees to bend backward, leading to pain. So, massaging this exact area on the front of your thigh releases the tight muscles. Then, your pelvis and knees return to their normal position, which can make your back, knees, and even shoulders feel comfortable. The muscle in this area is called the quadriceps femoris, and in fact, Clinical physical therapy research has also shown that releasing tension in the front thigh muscles reduces front, knee pain and alleviates excessive strain on the back. Now, I'll easily explain how to massage it. First, sit in a chair. Then, feel the front part where your pelvis and thigh meet. You'll feel a hard bone there. That's your pelvic bone. From that pelvic bone, run your fingers down towards your knee. And about 1/3 of the way, down from your pelvis to your knee, place your hand. That's the area we're going to massage. Now, press firmly on that area with your thumb. Not too hard, but with a pressure that feels slightly painful yet refreshing. Then, gently rub it left and right. You'll feel the tight muscles loosening. Massage one leg for about a minute, and then do the other leg for about a minute using the same method. What are the benefits of massaging the front of your thigh like this? As the tight muscles loosen, your misaligned back and knees return to their proper positions. This greatly improves back and knee pain. This muscle is called a two-joint muscle because one muscle can cause problems in both the back and the knees. When you press it initially, you might feel a slight stiffness, but as you continue to rub it, the muscles will gradually loosen and the pain will decrease. It's better to press with a slightly refreshing pressure rather than pressing too hard. Try it once now and massage this area for 3 minutes every night for a week. You will definitely feel a significant reduction in your knee and back pain. The second secret point is the soles of your feet. Stimulating your soles daily can greatly help with whole body joint pain. Jennifer, a 68-year-old living in New Jersey, had been having a really tough time lately, with a herniated disc since her early 50s. Just standing for 10 minutes would cause excruciating, electric shock-like pain from her back down to her hips. And while working at a restaurant, her biggest worry wasn't sales, but how much her back would hurt that day. She had tried everything: injections, physical therapy, hot packs, and even traditional Korean acupuncture, but the effects were only temporary. Eventually, she reached a point where she could barely walk without a cane. Her family suggested she should just get surgery. But after hearing from others that the pain returned even after surgery, Jennifer was hesitant to make a decision. It was then that her back condition worsened, and she came to see me. Jennifer's pain was so severe that she could barely straighten her back, and walked in hunched over. After reviewing her MRI and other tests, I suggested we first try consistently massaging her soles instead of immediately opting for surgery. Jennifer was puzzled, asking why she should massage her feet when her back hurt. I explained that the soles of the feet have many reflex points connected to nerves throughout the body, which can be incredibly helpful in relieving back pain. From that day on, Jennifer started massaging her soles 2 to 3 times a day while sitting comfortably. She focused particularly on the hollow part in the middle of her sole and near her heel. Surprisingly, she noticed that the movement of straightening her back felt much easier when she woke up just 3 days later. Her husband also commented that her walking had become much more comfortable, and when she came back to the clinic a week later, she was barely using her cane, looking radiant. I told her that while not everyone improves this quickly, the effects of improved blood circulation and corrected walking posture from the foot massage seemed to be particularly well suited for her. Now, Jennifer is also doing simple stretches to strengthen her abdominal muscles and managing her condition to prevent the back pain from returning. She says that while she doesn't know how long the effects will last, she is truly grateful just for the reduced pain without having to worry about surgery. And she actively recommends this method to others who are suffering. Massaging your soles well like this can improve various joint pains, including those in the knees, back, and hips. Why is that? The feet are concentrated with the starting points of various meridians and important acupoints. So there's an old saying that stimulating the feet benefits the whole body. That's why there are many shoes with acupressure effects on the market these days. In fact, stimulating the soles of the feet releases endorphins in our bodies, which improve mood and reduce pain. These substances act like natural painkillers produced by our own bodies. Medical research has also shown that providing foot massages to elderly people with knee osteoarthritis significantly reduced their joint pain. This shows that the Pain-relieving effect of foot massage is scientifically proven. So, how should you stimulate your soles? First, get into a comfortable position. You can sit in a chair and place one foot on the opposite knee, or sit on the floor with your legs bent so your hands can reach your soles. If your back is uncomfortable, you can lean against a backrest and do one foot at a time. Now, use your thumbs to press evenly across the entire sole of your foot. The middle part of the sole is particularly important. It's good to gently rub this area in a circular motion. You should feel a refreshing sensation when you firmly press the hollow part in the middle of your sole, the part we call the arch. If it's too painful, do it a little more gently. After that, it's important to massage every nook and cranny from your heel to the base of your toes. If there are any areas that feel particularly painful when pressed, they might be connected to somewhere else in your body. In such cases, don't press too hard, but stimulate them gently and repeatedly. About 1 minute per foot is enough. After massaging one foot, massage the other foot in the same way for 1 minute. If it's difficult to do it yourself, you can place a small ball or massage ball on the floor and roll your foot over it. This can make the massage more effective and easier. Stimulating the soles of the feet improves blood circulation, which also helps to remove inflammation and waste products from the body. Improved blood circulation also speeds up the recovery of tissues around the joints. Therefore, just massaging your soles can greatly help relieve whole body joint pain and reduce fatigue, especially if you have problems with lower body joints like your knees or hips. Consistently massaging your feet can be very beneficial. If you have wounds on your soles or have dulled sensation due to diabetes, be careful not to massage too hard. Now, let me introduce the third secret point, the back of your knee, specifically the popliteal fossa. Massaging the back of your knee is particularly effective for back pain. Let me tell you about one of my patients. He had spent most of his life standing while working in a factory. As a result, his knees started to swell and hurt from his 40s. And by the time he was over 70, it had become almost impossible for him to go up and down stairs. He was once advised to have knee surgery, but he hesitated due to his age and eventually ended up in a wheelchair as his condition worsened. He had tried physical therapy at various hospitals, painkillers and injections, but the effects never lasted more than a few days. Then he came to see me and I told him to try massaging the back of his knee 3 times a day. Initially, without much expectation, he pressed the hollow part behind his knee for about 3 minutes before going to bed each night. But what was peculiar was that he felt his back pain, rather than his aching knee, improve first. He had suffered from severe back pain his whole life due to bending over while working. But about a week after he started pressing behind his knee, he found it much easier to straighten his back when he woke up in the morning. By the second week, his knee pain had also noticeably decreased, and by the 3rd week, the chronic back pain that had plagued him for over 40 years had almost disappeared. He said he came because of his knee pain, but he was surprised that his lifelong back pain improved first. A month later, tests showed a significant decrease, not only in the inflammation levels around his knee joint, but also in the tension of the muscles around his spine. I explained to him that meridians connected to the entire body's energy pathways pass through the popliteal fossa behind the knee. So stimulating this area can improve pain from the back all the way to the toes. Now, he has recovered to the point where he can walk around his neighborhood 3 times a week, without a wheelchair or even a cane, and he has stopped taking all the back and knee medication he had been on his whole life. He even brought his neighborhood friends to thank me a while ago. Now, I'll explain in detail how to massage the back of your knee. First, sit in a chair and bend your legs slightly. This will create creases behind your knees. The hollow part in the center of those creases is the area you're looking for. If you hold your knees with both hands, as if you're cupping them, your thumbs will naturally land on this spot. Press that area with your thumbs for 2 to 3 seconds. Don't press too hard and cause pain. Press with moderate pressure, counting 1, 2, 3. After pressing for about 3 seconds, slowly release the pressure and remove your hands. Don't remove them. Abruptly release slowly, and feel the blood circulating. Repeat this pressing and releasing motion about 5 to 7 times. Stimulate the area regularly without causing too much pain. And do the same on the other leg. This method is particularly effective for symptoms where the leg is pulled due to a herniated disc, or when your back and legs ache from standing for a long time. If your knee feels tight after walking for a long time or climbing stairs, pressing this point can improve blood circulation and reduce pain. However, if there is severe inflammation inside the knee joint with swelling and heat, you should avoid acupressure and get plenty of rest. Try this simple 5-minute massage behind your knee tonight to break free from back and knee pain. You might see results faster than you think. While the effect is important, I'll tell you some important points to keep in mind when doing massage at home. First, don't use excessive force. Pressing too hard to the point of severe pain can actually be harmful. A pressure that feels refreshing yet slightly sore is appropriate. And if you feel sharp pain, reduce the pressure. The principle of massage is to do it gently without causing pain. Second, rather than directly pressing hard on joints or bony protrusions, massage the muscles and fleshy parts. Especially if you are elderly, your bones may be weak, so you need to be extra careful. Third, before massaging, it's even better if you gently rub the area to warm it up, or warm it with a warm towel as a preparatory exercise. Pressing cold muscles hard suddenly can be uncomfortable, so it's important to keep your body temperature warm. Fourth, don't hold your breath while massaging. Breathe comfortably. It's more effective if you think that the muscles are relaxing each time you exhale. Fifth, massage each area for about 1 to 2 minutes and do it consistently, about 2 to 3 times a day. Massaging for a long time unconditionally is not good, so it's important to do it regularly within a comfortable range. Sixth, you also need to consider your health condition. If you have swelling and heat due to arthritis, gently massage after reducing inflammation with an ice pack rather than massaging vigorously. If you have recently had surgery or an artificial joint, try it after consulting with your doctor. People with severe osteoporosis should also avoid excessive pressure. Finally, after finishing the massage, it's good to stand up and feel the changes in your body and do some light stretching. Drinking a glass of water can help eliminate waste products from your body, making it even more effective. If you do these 3 things along with the 3 massage methods I mentioned today, you will feel the effects even more clearly. First, when you wake up in the morning, do simple stretching for about 5 minutes and try to do light walking for about 10 minutes a day, which will further help your joint health. Second, taking a warm bath before bed will relax your muscles and help you sleep better. Third, when you eat, try to reduce salty or processed foods that worsen inflammation as much as possible. And it's good to eat plenty of fresh vegetables and fruits. And most importantly, consistency is key. Having treated patients for nearly 30 years, I've realized that those who don't give up just because they are old and improve little by little starting with small habits eventually regain their health. The method I've shared today is an amazing way to significantly reduce pain by investing just 3 minutes a day. Massage the front of your thigh, the soles of your feet, and the back of your knee for 5 minutes each day consistently. Even if it doesn't seem effective at first, you will definitely feel a clear change after a week or 2. I sincerely support your joint health and vibrant daily life. Please remember that healthy old age is not achieved suddenly, but is created by the accumulation of small efforts from this moment on. Out of the 3 pain relief points I shared today, which one would you like to try first? I support your healthy later years. Thank you.